All right, we're talking about the American Medical Association calling for a ban on direct-to-consumer advertising of prescription drugs. This is a shocker. Of course, the drug industry is flipping out over this, going, wait a minute, how are we going to, brainwash and hypnotize and indoctrinate all the consumers out there to ask for our drugs if we can't advertise to them on TV anymore? You see, they've created... You got to understand that the drug companies, long ago, they realized that they no longer could make all the money they want to make just by making treatments for sick people. Instead, they realized they had to get all the well people on drugs, like everybody. They had to get you on a drug from the moment you're born to the moment you die, and not just one drug, but maybe 5 or 10 or 15. And in order to do this, they had to create a bunch of fake diseases. It's called disease mongering. Seriously, that's a term, disease mongering. And they just invent all these fake diseases. Oh, you have restless legs syndrome. What are you jogging at night in your sleep? What are you, restless leg syndrome? You need a drug. And then they start marketing a drug, and all these people across America who had never even heard of restless leg syndrome, all of a sudden at night they're like, "Hey, maybe I have restless leg syndrome." And then the ad tells them, "Go to your doctor." I'm gonna go to my doctor. My legs feel kind of restless. They go to the doctor. And the patient's like, "Hey, doctor, my leg's been feeling really restless lately ever since I saw the restless leg syndrome commercial." And the doctor's like, "Well, you have restless legs. That's true." The doctor's getting a kickback from the drug company, right? He's got restless legs too. He wants his free trip to Hawaii paid for by the drug company. So he's going to write out the prescription. And then, patients go home and they say, "Look, honey, I got my medication for restless leg syndrome." And they take their pills. And it's all just BS, placebo. Well, I shouldn't say that. The treatment part of it is placebo. It doesn't, because it doesn't work. It's just all in your head. But the side effects are very real. So this person thinks they're getting their restless leg syndrome treated. Actually, they're getting some crazy side effect, like all of a sudden they can't poop but once a week, or oh no, I might go too far if I keep describing things. But you know what I'm saying? Crazy side effects that can happen, including sexual side effects. I was going to go there, but probably better not. In any case, people get all these crazy side effects, and then they think those are other diseases. So they go back to the doctor. "Look, I haven't been able to poop for a week," and the doctor's like, "Well, you need, what would we call that drug? If fixing your head is Abilify, then what? Fixing your fecal matter throughput must be called Poopify, right?" So the doctor writes on, you need Poopify. And the patient's like, "Yeah, you're right, I need some Poopify. The ad told me to ask my doctor about Poopify." The doctor writes out Poopify, and then the patient goes home. And now they're taking Abilify or whatever, and they're taking Poopify. And so it makes them poop, but now they can't get an erection, right? So I've been pooping all week, but I can't get any wood anymore. And so now they're all screwed up. They can't even have sex, and their marriage is falling apart or whatever. Or these days, maybe it's their gay sex partner hookup is falling apart. I don't know. They're on, what's that application? What's that called? Tinder? Tinder? Hell, I don't know. It's something like that. I don't know, like hookup app. So now they can't even do that, right? Their app is crashing because all their partners, So then they go back to the doctor. "Hey, you can't get an erection. Pooping like crazy." And then the doctor's like, "Oh, you need Woodify." Or whatever. It's just, obviously I'm making fun of this. At least I hope you realize I'm attempting to. But the point is, it's all so ridiculous. It deserves to be made fun of. This is all just utterly ridiculous, especially when it comes to psychiatric drugs, and they just make stuff up about kids. They observe a kid. "Well, that child, he's been putting 3 blocks on top of 2 blocks. One of them's yellow. Well, that child is has attention deficit disorder." They diagnose him with something, and then the kid hears the conversation and talks back to the psychiatrist and says, "No, I don't." And the psychiatrist says, "Aha, you have oppositional defiant disorder." and which is true. They actually have a disorder called oppositional defiant disorder, ODD. I'm not even making that up. That's in the DSM manual, DSM-4. The Psychiatry Bible, as it's called, which is an odd name and doesn't have anything in common with the Bible. You don't turn to like Psychiatric Revelations chapter, and the world was ending, but everybody had psych drugs, so they thought it was okay. No. So in any case, this whole thing is a sham. And the AMA has finally come to its senses on this issue. Well, I shouldn't say that. They're fighting for survival is what's going on, because the drug pricing is so outrageous. The abuses of the pharmaceutical industry are so outrageous. And we're talking about price fixing with hospitals. It's the prices with the federal government are fixed. The government can't negotiate with drug companies to get breaks on volume purchases for Medicaid. Did you know that? Or Medicare, I'm sorry, for Medicare. But even many states can't negotiate for Medicaid either. At the same time, the FDA enforces a national monopoly. It's kind of like the Berlin Wall of drug pricing. It's like we live in a medical North Korea, because you can't go to Canada and get your prescription drugs at a discount. You get arrested. Or if you're a city and you try to do that, you get shut down by the FDA. You're not allowed to go to Mexico and buy a bunch of medicine and come back and sell it to your friends, or even give it to your friends, even if they have a prescription. That's a violation of law. So it's an enforced monopoly, enforced at gunpoint. It's the Berlin Wall of medicine, and that is the United States. And so this system is designed to extract the most possible money and productivity from the U.S. economy as they can get away with. And right now, today, the sick care industry, which is all about managing diseases and not curing anything, not actually helping people heal, but rather keeping them sick and making sure they take more chemicals to continue to keep them sick. That whole system takes right now over 20% of the gross domestic product of the country, and that's the highest number on the entire planet by far. And that number is inching towards 25%. Think about it. 1 out of every $4 pretty soon will be spent on sickness management in America. That's crazy. I mean, most countries don't even spend that much money on food, not even that, or energy, or even defense, national defense. But America spends 20 to 25% of its GDP on sick care, and a lot of that is just these overpriced prescription drugs. And surely you've heard the stories of, what's this dude's name, Martin Shkreli or something? He's from Turing Pharmaceuticals, right? And he acquired that pill that treats some rare parasite infection that you might get if you travel to Timbuktu or something. And this pill used to cost like $1, and then it was like $9 or $11 or something, and then he just raised it. He bought the rights to it and just said, well, this pill now is like $500 a pill. And he never even apologized. He thinks it's great. This is his business model. He just buys rights to old, kind of boring niche drugs, or niche, I should say. And then he hikes the price up like 5,000% or more, and just says, well, you got to pay it if you want to live. So if you happen to travel to Timbuktu or wherever you get this parasite infection, and you actually get this infection, then treatment could cost you like $100,000. What are you going to do? Are you going to say no? No, you're going to mortgage your house, if you even have one, or sell your gold or whatever you have, and you're going to pay for the drug, and to try to save your life. Of course, if you know anything about natural medicine, you probably realize there are herbs that can do the same thing for like $5 instead of $50,000 or $100,000. But most people don't know that. In fact, I think the same chemical that's in that drug was in the cinchona tree in Central and South America, if I recall correctly. In any case, a lot of these chemicals can be found in nature for dirt cheap. And that, I think, is part of what's going into this whole panic by the American Medical Association, which is saying now, we have to shut down this drug advertising to consumers because it's causing prices to get so high and so outrageous that people are saying, to hell with pharmaceuticals, to hell with these medications. We're going to look for alternatives. And what are the alternatives? Medicinal herbs, Chinese herbs, Western herbs, Tibetan herbs, essential oils, even homeopathic remedies or homeopathy in combination with herbs, or acupuncture, chiropractic care, nutrition, superfoods, all kinds of amazing modalities that are safe, that are non-intrusive, and that are efficacious. In other words, they really work. They have virtually no side effects whatsoever. So the higher the drug prices get, the more affordable, by comparison, everything else becomes. And since Obamacare is a total fraud, and it's not affordable to anybody except those who are getting full-on subsidies from the government, most people are stuck now with huge, huge premiums, like a family of four, $20,000 a year for insurance. And your deductibles might be $5,000, $10,000, $20,000 or higher. And so it's a total scam. It's a complete ripoff. It's failing at every level. And in fact, United Health, I think, has announced that they may pull out. I think it's United Health. Yeah, United Health Group. They're going to pull out of Obamacare, they said. They're going to quit it entirely in 2017 because they're losing money on it. Even they're losing money on it. If they quit, this thing just collapses, by the way. It just falls. Obamacare is over at that point. It's only a matter of time before it all unravels. So anyway, the AMA is now, they figured out, they can read the writing on the wall. They know where this is going. And they realize that if we don't stop direct-to-consumer drug advertising, then people are just going to abandon the entire pharma model, and with it, their doctors. And you see, the AMA wants their doctors to have business. Well, if their doctors are nothing but glorified drug pushers, then why do people even need to go see them? They serve really no purpose. And people are finding that naturopaths and healing arts practitioners are actually the better healers out there. So that's who they're going to, and that's what this is all about. All right, this is Mike Adams here on TalkNetwork.com. I will continue this analysis of this shocking news from the AMA in part 3. Stay with me. Well, thank you for listening to this episode of the Health Ranger Report. Please support us by visiting our online store at store.naturalnews.com, where you can find the world's cleanest, laboratory-validated superfoods, nutritional supplements, personal care products, shampoo, chemical-free products, just about everything for your home and body and health that you might want, including supplements for your pets as well. Everything is laboratory validated in our forensic food lab, and we don't sell something unless it tests clean. I think we're the only online reseller to do this really extensive testing of everything that we sell. If we don't like the lab test results, meaning if it's not really, really clean, including with heavy metals, then we don't sell it, period. We have free shipping on orders over $99 and a satisfaction guarantee on everything that we offer. So check us out now at store.naturalnews.com, and thank you for your support.